Hi, I'm Dr. Kirk Campbell from Mount Sinai, New York City, and on behalf of my co-authors, I'd like to present an overview of our recently published manuscript, Practical Considerations for the Use of Sparsentan in the Treatment of Patients with IgA Nephropathy in Clinical Practice. IgA nephropathy is the most common primary glomerular disease in the world, and it can be progressive, leading to kidney failure in 10 to 20 years after being diagnosed. Clinical practice guidelines recommend reducing proteinuria and controlling blood pressure to help slow disease progression and offer kidney protection. Until recently, there were no FDA-approved treatment options for IgA nephropathy, but the space is rapidly evolving. In this paper, we provide practical guidance on the use of sparsentan, a new FDA-approved treatment for adults with IgA nephropathy at higher risk for worsening disease. Sparsentan is the first non-immunosuppressive medication approved by the FDA for the treatment of IgA nephropathy to reduce proteinuria. Sparsentan, taken as a once-a-day pill, targets two important pathways as shown in this figure, endothelin-1 and angiotensin-2, that lead to the loss of kidney function in IgA nephropathy. This article gives practical advice on how to use sparsentan in clinical practice in adults with IgA nephropathy. We provide guidance on who should get sparsentan, how to start treatment, and how to check if treatment is working for the patient. As shown in our flowchart, we discuss important considerations for who to treat with sparsentan and how to start treatment. Sparsentan must not be started if pregnancy is present or if aminotransferases are 3 times the upper limit of normal. We discuss management of any patient-reported tolerability symptoms, for example, hypotension, to allow continued treatment. Additionally, the paper provides guidance on key topics related to treating patients in clinical practice, including assessments prior to starting sparsentan and periodic monitoring during treatment, monitoring safety and managing potential adverse reactions, efficacy monitoring, including the assessment of proteinuria, concomitant medications, for example, the use of SGLT2 inhibitors, and special populations, for example, advanced kidney disease and elderly patients. In the overall clinical experience with sparsentan, including more than 1,200 patients treated in clinical trials, the drug has been well tolerated with a consistent and manageable safety profile. Sparsentan treatment of adults with IgA nephropathy in the PROTECT clinical trial showed significant reduction in proteinuria that was maintained over the 2-year trial period. In this paper, we've outlined a program for patient identification, treatment initiation, efficacy and safety monitoring, and considerations for special populations.